How does a radiologic technologist perform a pancreatic CT scan? Imagine getting a detailed look inside your body to see how your pancreas and nearby blood vessels are doing. That's exactly what a radiologic technologist helps accomplish during a pancreatic computed tomography scan. The process starts with preparing the patient. The technologist asks the patient to wear loose clothing and remove any metal objects like jewelry or eyeglasses, because these can interfere with the images. Sometimes, the patient is asked to change into a gown for better comfort and to avoid any metal that might distort the scan. If contrast dye is part of the procedure, the technologist makes sure the patient has fasted for several hours beforehand. They may give the patient oral contrast about 20 to 30 minutes before the scan to help highlight the gastrointestinal tract. An intravenous line, or Roman 4, is then placed into a vein, usually in the arm, to inject a special contrast dye called iodinated contrast during the scan. This contrast helps make the images clearer by showing blood vessels and tissue details more distinctly. Once everything is set, the patient lies flat on the scanning table, usually on their back. The arms are raised above the head to prevent any parts from blocking the view and to improve image quality. The technologist carefully centers the abdomen within the scanner's opening, called the gantry. The scan uses a pancreatic protocol, which involves taking images into main phases after contrast injection. First is the arterial or pancreatic phase, which happens about 15 to 20 seconds after the contrast is injected. During this time, the scanner captures images that highlight the arteries supplying the pancreas, like the celiac axis and superior mesenteric artery. This helps identify any tumor blood supply and assess if the tumor involves nearby arteries. The second phase is the venous or portal venous phase, which occurs around 60 to 70 seconds after the contrast is injected. These images focus on the veins, such as the portal vein and splenic vein, as well as the liver tissue. This phase is important for detecting any invasion of veins or spread to the liver. During the scan, the technologist uses special controls to adjust the radiation dose based on the patient size, making sure the images are clear but the exposure is minimized. The scanner takes very thin slices of the body, often less than 1 millimeter thick, to produce high-resolution images. The scan usually covers from the middle of the diaphragm down to the top of the hips, but sometimes it extends further if needed. The technologist may slightly reposition the patient to get different angles, including cross-sectional views, which are very helpful for diagnosis. Throughout the procedure, the technologist keeps an eye on the patient to ensure they are comfortable and still. Moving during the scan can blur the images, so staying still is very important. Once the images are captured, the Roman 4 line is removed, and the patient is given instructions about what to do next, especially if contrast was used. They may be advised to drink plenty of fluids to help flush out the contrast dye. This pancreatic CT scan with contrast is the preferred method for diagnosing pancreatic cancer because it provides detailed pictures of the pancreas, the tumor's size and location, and whether blood vessels are involved. These details are crucial for planning treatment or surgery. The use of biphasic contrast-enhanced imaging greatly improves the accuracy of the results compared to scans without contrast. In summary, the technologist carefully prepares the patient, administers contrast when needed, positions the patient correctly, and performs a detailed, two-phase scan to produce high-quality images. These images help doctors make accurate diagnoses and develop effective treatment plans, supporting overall pancreas health. Always remember to consult healthcare professionals for personalized medical advice and to discuss any concerns about the procedure.